Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Why Etodolac Discontinued Lodine and Ibuprofen are used for chronic pain. Ibuprofen and Etodolac are two types of nonsteroidal anti-inflammatory drugs, NSAIDs, used to treat arthritis pain. /r/n/r/n being of the same drug class, ibuprofen and Etodolac have a lot in common. Both reduce inflammation and pain sensation, easing the severity of symptoms. That said, there are also crucial differences. /r/n/r/n Etodolac, previously sold under the discontinued brand name Lodine, is a prescription-only generic drug typically indicated for osteoarthritis, rheumatoid arthritis, and other forms of acute pain. /r/n/r/n Ibuprofen is available in numerous over-the-counter, OTC, and prescribed forms and takes on a wider range of pain, including arthritis. /r/n/r/n It is important to understand how to use Etodolac and ibuprofen safely. Both medications can negatively interact with each other and with other drugs and supplements. The chances of adverse effects increase significantly if Etodolac and ibuprofen or any two NSAIDs are taken together. /r/n/r/n/FatCamera, E+, Getty Imagesrnrn Etodolac is currently available by prescription as generic only. The brand name, Lodine, has been discontinued in the US. /r/n/r/n Though there are similarities between these NSAIDs, there are also some key differences. Here's a quick breakdown. /r/n/r/n Like all NSAIDs, both Etodolac and ibuprofen prevent the activity of enzymes called cyclooxygenases, COX, which help your body produce prostaglandins. These hormone-like chemicals are essential for pain and swelling in the body, so inhibiting their activity eases symptoms. Each is often prescribed for rheumatoid arthritis and osteoarthritis. /r/n/r/n Since Etodolac and ibuprofen function in this way, their side effects are also similar. While there are more for Etodolac, common side effects of both include /r/n/r/n Severe side effects for these drugs are also identical and can include allergic reactions such as breathing difficulties, facial swelling, and hives. /r/n/r/n Treatment of arthritic conditions is a matter of long-term symptom management, during which either ibuprofen or Etodolac may play a part. This may lead you to question, is one better than the other? /r/n/r/n Though Etodolac seems to have an edge, the answer is a little complicated. A formative, double-blind study conducted in 1997 comparing the two for rheumatoid arthritis found them equally effective during the first 2 months, with ibuprofen showing less efficacy over the long run. For up to 3 years of therapy, Etodolac offered better symptom management. /r/n/r/n However, it should also be noted that ibuprofen has consistently been found to be among the safest of NSAIDs, and certainly safer than Etodolac. Especially in moderate doses, it's been shown to lead to relatively few adverse events. No doubt. This is why ibuprofen use is so widespread and has such a long history. /r/n/r/n Whenever you are prescribed a medication, it's important to be aware of any other drugs, supplements, or herbs that may not be safe to take at the same time. This is especially important when managing chronic conditions requiring continual medication. /r/n/r/n When taking any NSAID, using another one at the same time significantly increases the chance of adverse side effects. The Food and Drug Administration, FDA, specifically warns against using ibuprofen and Etodolac at the same time. /r/n/r/n Consult your healthcare provider if you are taking prescription or over-the-counter medications for pain but still struggle with discomfort and inflammation. The management of chronic conditions often requires a multifaceted approach. /r/n/r/n The use of NSAIDs, though common, comes with risks. Most significantly, according to the FDA, there is a chance that this class of drugs can lead to heart attack and stroke in the following cases, /r/n/r/n. In addition, NSAIDs can also affect gastrointestinal health, leading to intestinal bleeding, stomach ulcers, and perforation of ulcers. The risk of any of these occurring rises with age, and prompt medical attention is necessary if they arise. /r/n/r/n. Finally, the use of ibuprofen, Etodolac, or other NSAIDs may also lead to /r/n/r/n. Some side effects of NSAID use constitute medical emergencies. If you experience any of the following, seek emergency medical treatment right away. /r/n/r/n. Ibuprofen and Etodolac each have their utilities, and both drugs are useful in different ways to treat conditions like osteoarthritis or rheumatoid arthritis. /r/n/r/n. Common side effects of both medications can include stomach upset, dizziness, nervousness, and ringing in the ears. Severe side effects of NSAIDs like ibuprofen and Etodolac may include allergic reactions such as breathing difficulties, facial swelling, and hives. /r/n/r/n. If you take these NSAIDs or any other medication, it's essential to understand how they work and how to use them safely. Negative effects can occur if they are taken together, with other NSAIDs, or with certain other drugs and supplements. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.